Dry eye, simply put, is when your eye doesn't produce enough lubrication to keep your eye comfortable and functioning properly. If your tears aren't produced adequately, you're chronically affected and it can have profound effects on your vision. Many people think the dry eye comes from getting old. Well, that's not the only cause of the problem. Many young people can get it, and often it's associated with the lifestyle and the habits that we have nowadays. Our houses have got air conditioning, they've got central heating. Both of these dry out your eyes something terrible. And it's an unusual fact, if you look at someone sitting in front of a computer screen, your blink rate drops by more than half, and you sit with your eyes held open for longer, your tears evaporate, your eyes get dry. And that feeling that people come in and tell us about whether their eyes are tired working on a computer, no, they're not. Your eyes are dry working on a computer. The main symptom we get when people come in with problems of dry eye is a gritty sensation. It's like sand in your eye. Often your eye can be red, your eye can be a little bit inflamed. And believe it or not, sometimes it can be a pain so intense that even your optometrist won't believe it's dry eye you've got. They'll think there's something more serious going on. Treatment, primarily, we would talk about getting you to make sure you're drinking enough water through the day. We talk about your blink rate, talk about the environment that you work in to see if we can do it. But ultimately, it's all about restoring the tear balance to your eyes. So as part of the assessment of your eye, we'll look to see if we can see a specific cause for your dryness. The other treatment is just simply using an artificial tear. Now, if it's an environmental problem you've got, like your computer, we'll give you simple artificial tears that really are just a lubricant to keep your eyes comfortable. If you find yourself experiencing some of these symptoms, the dryness, the grittiness feeling, or the red eye, come into your optometrist, get them to have a look at it and see if they can work out what the cause of your dry eye is. If we can find the cause, we can target the treatment better. The main thing for you to understand is all we can do is alleviate the symptoms. There isn't a cure for dry eye. If you've got dry eye, you've got dry eye. We can just make it tolerable and less uncomfortable for you. That generally is long term as well.